providers can improve future outcomes of infants exposed to substances by including a careful multidisciplinary team in discharge planning. Infants who have been exposed to substances in utero are at high risk both prenatally due to the effects of substances on the developing fetus and in the postnatal period due to potential exposures through breast milk or inhalation. Infants born to parents who use substances are at increased risk for attachment disorders, neurodevelopmental and behavioral issues, as well as potential safety concerns. Not all infants who are exposed to substances will experience medical issues in the neonatal period, such as neonatal abstinence syndrome. However, prenatal exposure to some substances, such as alcohol, may lead to medical or developmental issues later in life, which may require lifelong support services. As such, discharge of any infant exposed to substances should include careful planning and involvement of a multidisciplinary team. In addition, a referral to child welfare may be necessary. With input from a multidisciplinary work group, Chosen Quick has developed a set of comprehensive plans of safe care tools that include a discharge checklist that focuses on the medical and social needs of the child and family. Ideally, discharge planning will begin prior to delivery, with the family identifying a primary care provider for the infant to see after discharge from the hospital. Understanding the elements of the plan of safe care prior to delivery will allow the family to prepare for their infant's arrival and homecoming. The 4 elements of a plan of safe care are physiologic readiness, discharge planning, including a home care plan with community referrals, follow-up arrangements, and caregiver education. Timing for discharge should occur when the infant is physiologically mature and medical issues have been resolved. Discharge planning and arrangements for follow-up are completed, and the parents and primary caregivers have received all necessary education and training. Components of a home care plan should include identification and education of in-home caregivers, formulation of a plan for nutritional and medical care, development of a list of required supplies, if applicable, identification of primary care physicians, PCP, for both the infant and their caregiver, identification of appropriate community resources, identification of substance use disorder treatment programs or recovery supports for caregivers, if applicable, assessment of the adequacy of home environment, development of emergency care and transport plan, assessment of financial resources. With respect to parent and caregiver education, they must exhibit readiness to assume full responsibility for the infant's care after discharge. When possible, at least 2 caregivers should be identified to learn the necessary care of the infant. Development of an individualized teaching plan during the hospitalization may facilitate education and skills needed to care for the infant. Consider creating a checklist to outline tasks needed to be mastered prior to discharge. Follow-up appointment for the infant with a primary care provider should be arranged prior to discharge. Pertinent information about the hospitalization should be verbally communicated to the primary care providers prior to discharge, and the completed discharge summary should be documented in the medical record and sent directly to the primary care providers. Infants exposed to substances in utero are at increased risk for neurodevelopmental delays and should be monitored periodically after discharge for developmental progress and timely referrals to early intervention programs when appropriate. In addition to follow-up for the infant, follow-up for the caregiver should be identified prior to discharge as well. For more information and training on plans of safe care, access the Plans of Safe Care web-based training for hospital mandatory reporters through the Colorado Child Welfare Training System at www.coloradocwts.com. For additional community resources, contact your county's Department of Human Services. For further information and to access all provider resources, including the Plan of Safe Care guidelines and checklist, please visit chosencollaborative.org.